Are you curious about those light and dark patches on your skin? Dive into this comprehensive video as we unravel the mysteries of tinea versicolor, which is a common skin condition that affects millions worldwide. In this video, we'll explore the pathogenesis, where we'll discover the underlying causes and factors that contribute to the development of tinea versicolor, its risk factors, where we'll learn about who is more likely to develop this condition and why, its clinical features, where you'll understand the signs and symptoms that characterize tinea versicolor, helping you to identify it easily, the diagnosis, where you'll find out how healthcare professionals diagnose this condition and the tests involved, and the treatment, where we will explore the various treatment options available, from topical solutions to lifestyle changes. Whether you're a medical student, a healthcare professional, or just someone looking to learn more about skin health, this video provides valuable insights and practical advice. Don't forget to like, share, and subscribe for more informative videos on health and wellness. Welcome to Medspire Educational Group. So please note that this content is for educational purposes only. Please consult your healthcare professional for proper diagnosis and treatment of your skin condition. Thank you. So to give an overview of our presentation today, we'll first go into an introduction of the topic, the risk factors, the pathophysiology, the clinical features, diagnosis, treatment, and we'll also discuss a question and its explanation. So, what is tinea versicolor? What comes to your mind when you hear the word tinea versicolor? It is also known as pityriasis versicolor, meaning many colors. It is a mild, non-contagious, chronic, superficial fungal skin infection caused by the lipid-dependent yeast-like fungus Malassezia species, which is previously known as Pityrosporum. Its prevalence, it occurs worldwide, and it's most prevalent in humid and warm tropical regions, and it tends to be more active in summer seasons. So, what are the risk factors of tinea versicolor? So, we have hot and humid environments, the application of oily emollients, hyperhidrosis, that is increased sweating in individuals, pregnancy, because pregnancy has hormonal changes and weakened immune system. So individuals are more prone to tinea versicolor during pregnancy. Also, oral contraceptives and corticosteroids, endocrine and neuropathic disorders, malnutrition, poor general health, and some individuals also have a genetic predisposition to tinea versicolor. So, the pathophysiology. It is caused by a dimorphic yeast-like fungus which lives on the normal skin. So it's a commensal fungus which is known as Malassezia species. So this Malassezia species lives on your normal skin and doesn't cause any problems, but it can transform to its problematic pathogenic filamentous form when it's exposed to hot and humid conditions. So this pathogenic form now produces an acid, a dicarboxylic acid known as azelaic acid. And this azelaic acid has a tyrosinase inhibitory activity and its toxic melanocyte effect, which dysregulates melanin production in the skin, leading to hypopigmentation. So, this azelaic acid acts at many sites in the pathway of melanin production, inhibiting tyrosinase. There's also hyperpigmentation and erythematous lesions, which may be a consequence of the inflammatory reaction to the yeast. So its clinical features, it's often asymptomatic, and there's hypopigmented, hyperpigmented, and erythematous macules, as we have discussed. And its distribution, it's usually in the trunk and upper extremities in adolescents and adults, which has highly active sebaceous glands, and usually on the face in children. It may or may not have fine scales and itching. So its diagnosis is usually clinical, where your healthcare provider can look at your skin and see the hypopigmentation and the hyperpigmentation. Usually, a potassium hydroxide test can be done to also help in its diagnosis, where you will see hyphae and yeast cells in a spaghetti and meatball pattern, as you can see here. So the treatment, there are many antifungal drugs that can be used to treat Tinea versicolor. We have topical creams and lotions. We have oral medications for severe infection, and also anti-dandruff shampoo and soaps can be used. So under the topical creams and lotions, we have terbinafine, clotrimazole, miconazole, ketoconazole, and cyclopirox. Under the oral medications for severe infections, we have fluconazole, itraconazole. And anti-dandruff shampoo and soaps, we have ketoconazole, zinc pyrithione, selenium sulfide, and sulfur. So in persistent cases, you may need to take this medication once or twice a month to prevent the infection from recurring. And please note, it has a high recurrence rate and usually need continuous prophylactic treatment. So to get more into the dosage and duration of these medications, we have terbinafine, 1% cream, which can be used twice daily for 1 week. There's also selenium sulfide, 2.25% shampoo or 2.5% lotion, which is 1 10-minute application daily for 1 week. There's zinc pyrithione 1% shampoo, which is 1 5-minute application daily, duration 2 weeks. There's a ketoconazole 2% shampoo, which is 1 5-minute application daily for 3 days. There's a cyclopirox, which is 0.77% cream, which you can apply 2 times daily for 2 weeks. There's a fluconazole. For adults, we have 300 milligram orally once weekly for 2 weeks. There's a itraconazole. For adults, there's 200 milligram orally once daily for 5 days. There's a clotrimazole twice per day for 2 weeks. There's a efinaconazole once per day for 2 weeks. And there's miconazole twice per day for 2 weeks. Again, please consult your healthcare provider to see which one of these treatments is best for you. So we will get into a question, a USMLE MBME style question to help those who are in medical school and who are studying and watching the video. So this question states, a 28-year-old male presents with hypopigmented scaly patches on his trunk that have not responded to over-the-counter antifungal creams. He reports occasional mild itching, especially in warm weather. On examination, multiple well-defined round to oval hypopigmented patches are noted on his chest and back. Potassium hydroxide preparation of scale scrapings reveals the presence of spaghetti and meatball appearance. Which of the following is the most appropriate treatment for this condition? Which of the following is the most appropriate treatment for this condition? So the answer is oral fluconazole. In this scenario, the most appropriate treatment option for this patient is C, oral fluconazole. So oral fluconazole is effective against Malassezia species and is recommended for widespread or refractory cases of Tinea versicolor. Topical treatments like clotrimazole may be considered for localized or less severe cases, but given the extent of the involvement and lack of response to the over-the-counter creams, oral fluconazole is the preferred choice. Therefore, option C is the correct answer. For option A, topical corticosteroids, topical corticosteroids are not appropriate for the treatment of Tinea versicolor. While they may reduce inflammation and itching temporarily, they do not treat the underlying fungal infection caused by Malassezia species. In fact, corticosteroids can potentially even worsen fungal infections by suppressing the immune response and promoting fungal growth. Choice B, topical clotrimazole. It's an antifungal agent that can be effective for mild cases of Tinea versicolor. It works by inhibiting the growth of fungi. However, in cases where there is extensive involvement or failure of over-the-counter treatments, oral antifungal agents like fluconazole are generally preferred for their systemic actions. Choice D, oral terbinafine. Oral terbinafine is primarily used to treat dermatophyte infections such as Tinea corporis, ringworm, Tinea cruris, jock itch, and Tinea pedis, athlete's foot. It is not typically used as a first-line treatment for Tinea versicolor caused by Malassezia species. And choice E, observation without treatment. Observation without treatment is not appropriate for Tinea versicolor, especially when the patient is symptomatic itching and the condition is affecting the patient's quality of life. Tinea versicolor can persist and worsen without treatment, leading to further pigmentary changes and potentially spreading to other areas of the body. So the answer for this is oral fluconazole. Thank you so much for watching. Don't forget to subscribe. You can also follow us on med_spire on Instagram or reach out with any questions or concern. Thank you.